Hi, my name is Devin. I'm a family nurse assistant at the University of Memphis, and I'll be assessing you today. I'm going to start out with my assessment by going on and saying I'm going to be assessing your head, neck, face, posterior, anterior chest, and your abdomen. I'm going to be assessing for color, texture, turgor, moisture, nevi, bruising, scarring, lesions, and any edema that you may have. And the next thing I note is that your head is midline and straight. It's normocephalic, and there's no obvious deformities. Now I'm going to assess your head and hair. I see that your hair is dark in color, coarse in texture, and evenly distributed. There's no lesions, masses, or depressions noted. Did you have any tenderness? I did not notice any infestations. Now I'm going to palpate your temporal arteries. Did you have any tenderness? Okay. Now I'm going to move on and I'm going to go and palpate your lymph nodes. So I'm going to go preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Those are all soft and mobile. Did you have any tenderness? Okay. Now I'm going to go on and check you for TMJ. So I'm going to get you to open and close. All right. I did not notice any subluxation or crepitus. Did you have any tenderness? Okay, good. Now we're going to move on to cranial nerve number 5, which is your masseter muscle. And I'm going to get you to clench when I touch, and that is equal bilaterally. And the second part of cranial nerve number 5 is going to be your soft touch. So I'm going to get you to tell me, close your eyes and tell me where I'm touching.
Forehead, right cheek, left cheek, chin, nose.
Okay, perfect. Now, the next thing we're going to do is move on to your ears. I see that your ears are an appropriate size for your head, and your ears are an appropriate size for your head. They are symmetrical. There's no obvious deformities. I'm just going to go and palpate your pinna and tragus, and I don't palpate any masses. Did you have any tenderness when I did that? Okay, great. Now I'm going to check your right ear. And your ear canal is free of debris. Your tympanic membrane is intact and convex. And this ear canal is free from debris as well. There's no erythema noted in either eardrum, no wax buildup or anything like that. Now I'm going to move on to testing your hearing. I'm going to conduct 3 tests for your hearing. The first of which is going to be the whisper test. So I'm going to say 3 words and I'm going to get you to repeat those words, okay? Okay. Jacket. Suit. Okay. So you do have gross hearing intact. Now I'm going to do a Weber test, and it's going to test for lateralization. You can tell me if this is louder on the left or the right.
On this side.
Okay. Now I'm going to get you to lean up for me and tell me when the sound stops.
Stop. 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 Stop.
All right. And that second test was the Renee test. And that is the last test for your hearing, and that tells me if your air conduction is greater than bone conduction, and it is. So cranial nerve number 8 is intact, and your gross hearing is intact. Now I'm going to move on to cranial nerve number 7. So I'm going to have you smile, frown, pucker your lips, puff your cheeks, raise your eyebrows. All right, cranial nerve number 7 is intact. Now I'm going to move on to the eyes. I do note that your eyelashes and eyebrows are evenly distributed. They're dark in color. There's no signs of infestations. And your palpable fissures are appropriate height and width for your age with no obvious deformities. I'm going to go and get you to look up for me. Your sclera is pink and moist. Your sclera is white and moist, and your conjunctiva is pink and moist with no discharge or lesions noted. All right, I'm going to move on to cranial nerve number 2, which is going to be visual acuity and central and peripheral vision. So I'm going to check central and visual acuity first. Cover your right eye and read this line for me.
PHGBS.
Cover your left eye.
OLCF.
Perfect. Now both eyes.
OLCF.
Perfect. So that is the first part, central vision intact and gross visual acuity of 2020. I'm going to get you to sit up for me. Watch this finger and tell me when you can see these.
I can see it. I can see it.
All right. Cranial nerve number 2 is intact with visual acuity, peripheral vision, and central vision. Okay, now we're going to check for cranial nerve number 3, which is light accommodation, direct and consensual. And you do have direct and consensual light accommodation from 5 millimeters to 3 millimeters. And now I'm going to check for red reflex. And your red reflex is present and equal bilaterally with a well-defined optic disc. Right, now I'm going to check cranial nerves 3, 4, and 6, which is extraocular movement with conjugate gaze. So I'm going to get you to watch my finger. And your eyes are moving symmetrically with no nystagmus noted. And then the last eye exam I'm going to perform is for accommodation and convergence. So I'm going to get you to watch my finger. And your eyes did accommodate with your pupils and they did converge. That's a normal finding there. Now I'm going to move on to your sinuses and nasal assessment. I do note that your nose is straight and midline. I'm going to palpate your frontal sinuses, maxillary sinuses. I did not palpate any warmth. Do you have any tenderness? Okay. I'm going to get you to close one nose and breathe out. And the other one. Okay. So your nose is patent bilaterally. Now the last thing I'm going to do is check your sense of smell. So smell this for me. What does that smell like?
Peanut butter.
Okay, and so that is a sense of smell intact, cranial nerve number 1. Excuse me. Now I'm going to look into your mouth. So I'm going to have you open up for me. All right, your tongue, the floor of your mouth, your salivary ducts, buccal mucosa, posterior pharynx, the roof of your mouth, your tonsils are absent, your gums and your lips, they're pink, moist, and intact. Your teeth are white and well aligned with no obvious caries. So now I'm going to get you to say ah. And your soft palate and uvula did rise with pronation. That's cranial nerves number 9 and 10 intact. I'm going to get you to stick your tongue out. And there's no fasciculations on your tongue, meaning cranial nerve number 12 is intact, okay? So I do believe that completes our head and neck assessment. Now we're going to move on to your chest assessment. So I'm going to go ahead and start by noting the anterior and posterior chest are equal symmetrically. There's no obvious deformities. There's no signs of retractions, tachypnea, cyanosis, nasal flaring, tripod positioning. There's no use of accessory muscles, nasal flaring, tripod positioning, cyanosis, tachypnea. Or retractions noted. And so now I'm going to move on to your back assessment, the assessment of your posterior chest. I'm going to get you to turn so we can see the camera. And then I'm going to start by auscultating your lung fields, and so you can breathe normally while I do this. All right, all of your lung fields are clear with no adventitious lung sounds noted bilaterally. Now I'm going to check for egophony, so I'm going to get you to say the letter E when you feel my stethoscope. And that did sound like the letter E and not A, indicating there's no consolidation. Now I'm going to check bronchophony. I'm going to get you to say 99. All right, and that indicated that there was no consolidation as well. Lastly, I'm going to check whisper pepicolloquy. I'm going to get you to say 1, 2, 3. Okay, and again, no consolidation noted there. Now I'm going to go on and palpate for equal chest expansion. So I'm going to get you to take a deep breath and out. And you do have symmetrical chest expansion. Now I'm going to palpate tactile primitus. I'm going to get you to say 99. And that vibration was felt equal bilaterally, so no consolidation noted there. Now I'm going to percuss between your in your intercostal spaces, and that is a reticent sound indicating no consolidation. While I'm on your back, I am going to go on and assess for vertebral tenderness. Any tenderness? No. Okay. Any tenderness? No. Okay, you can go on and turn around for me. Now I'm going to go on and assess your anterior chest. I'm going to start by listening to your lung sounds. You can breathe normally. And those lung sounds were clear and equal bilaterally with no adventitious lung sounds. Now I'm going to palpate for symmetrical chest expansion, deep breath. You did have symmetrical chest expansion. Now I'm going to palpate for tactile primitus. So I'm going to get you to say 99. And that vibration was felt equally. So that does complete our respiratory assessment. Now I'm going to move on to our cardiac assessment. I'm going to start by palpating the point of maximum impact. And there was no thrills noted there. And I'm going to circle back really quick before we finish up our cardiac assessment. I'm going to palpate the trachea. It is midline. Now I'm going to palpate your thyroid. Swallow. Swallow. That was soft and mobile with no nodules. Did you have any tenderness? Okay. Now I'm going to palpate for carotid pulsation. That's +2 pulsation bilaterally with no turbulence palpated. Now I'm going to auscultate for bruits. And that was clear to auscultation with no bruits noted. Now I'm going to go back to your cardiac assessment. I'm going to assess your apical pulse for 1 full minute. It's 88 beats per minute with normal rate and rhythm. Now I'm going to move on to your cardiac auscultation points. I'm going to start with the aortic, pulmonic, Erb's point, mitral, tricuspid. That was with the diaphragm on my stethoscope. Now I'm going to repeat that assessment in reverse with the bell, starting with the tricuspid, mitral, Erb's point, pulmonic, and aortic. There was no gallops, murmurs, or rubs noted on that cardiac assessment. So I am going to go on and have this patient lay down for me. Okay, and with the patient lying down, I do notice there's no peaks and lifts. The abdomen is round and contour and flat. There's no masses or obvious deformities of his abdomen. All right, now I'm going to check him for jugular vein distension and pulsation. So turn your head to the right. There's no jugular vein distension or pulsation noted. Okay, and you can relax your head again. Now I'm going to palpate my cardiac assessment points, aortic, pulmonic, Erb's point, mitral, tricuspid with no bruits palpated. Now I'm going to repeat that auscultation. Same sections, aortic, pulmonic, Erb's point, mitral, tricuspid with no murmurs, rubs, or gallops noted in that portion of the cardiac assessment. All right, now I'm moving on to our abdomen. I'm going to go on and auscultate for the for vowel sounds, starting in the lower right quadrant. Vowel sounds are normal, active in all quadrants. Now I'm going to auscultate the abdominal arteries, starting with aortic, renal, iliac, and femoral. And there was no bruise noted on any of those auscultations. So the next thing I'm going to do is percuss this patient's abdomen. And there was no dullness or flatness noted. Did you have any tenderness? Okay. And that was a tympanic sound. Now I'm going to move from light to deep palpation. Did you have any tenderness? Okay. I did not palpate any masses or any pulsations in the abdomen. Now I'm going to palpate the liver. Or attempt to palpate the liver. It is non-palpable. Right? Now on the left-hand side, I'm going to palpate the spleen. So I'm going to have my hand placed behind the back, take a deep breath in, and the spleen is non-palpable. So that does complete our abdominal assessment. I have the patient sit up for me. Okay. Now I'm going to go on and note the skin of his upper and lower extremities is warm, dry, and intact with no edema noted, no lesions. All of his extremities are present. And we're going to move on to a couple of tests. I'm going to start with the vibration over his wrist and medial malleolus. Do you feel that vibration? And that vibration. All right, the other side. All right, and that sense is intact. Okay, now I'm going to move to light touch sense over his upper and lower extremities. So close your eyes for me and tell me where I'm touching.
Right arm, left arm, left arm, right arm, right leg, left leg, left leg, right leg.
Okay, perfect. So he does have light sense, light touch intact in his upper and lower extremities. Now I'm going to move on to testing his deep tendon reflexes. I'm going to start with the brachioradialis, +2 in wrist, bicep, +2 in varus, and then tricep is +2 in wrist, and on the other arm, same assessment, starting with the brachioradialis. Biceps, and then tricep. And that is +2 in wrist. I'm going to move on to his knees and check the assessment of his knees. +2 and brisk in the right knee, +2 and brisk in the left knee. I'm going to start with I'm going to move to the left Achilles, +2 and brisk, right Achilles, +2 and brisk. I'm going to check Levinsky, and he does have a negative Levinsky bilaterally. Okay, now I'm going to move on to checking sterignosis and graphesthesia. So I'm going to start with graphesthesia. I'm going to have you close your eyes and tell me the letter I'm writing. Okay? Okay, and graphesthesia is intact for this patient. Now I'm going to get you to close your eyes and tell me what I'm placing in your hand. Okay? Okay, so that is sterignosis intact for this patient, okay? So now I'm going to move on to cerebellar coordination. So I'm going to get you to do hand flip-flops, serial finger opposition, and then touch my finger here. And the other side. Okay, you do have cerebellar coordination intact. Now I'm going to move on to checking the capillary refill. I'm going to start with your feet. I'm going to check the capillary refill in your toes. It's less than 3 seconds. I'm also going to check the dorsalis pedis here. It's +2 bilaterally. And the posterior tibial pulse, it's +2 bilaterally. Now I'm going to move on to his hands. The capillary refill in his fingers is less than 3 seconds. And then we're going to check radial pulses. And that's equal bilaterally with a normal rate and rhythm. All right, so now we're going to move on to I'm going to go in and assess all of his joints, starting with his toes, ankles, knees, hips, hands, wrists, elbows, and shoulders. There's no redness, swelling, obvious deformity, nodules, crepitus noted in any of those. Redness, swelling, nodules, crepitus, obvious deformities, and they were all symmetrical on all of those joints that we just checked. Now I'm going to move on to checking strength. I'm going to start with the strength of his hands, squeeze, 5 out of 5 strength in both hands. Now I'm going to check the strength of his bicep and tricep, so push and pull, and that's 5 out of 5 strength there. Now I'm going to have him raise against me and push against me, and 5 out of 5 strength in our shoulder. I'm going to have you lean up and shrug against me, and he does have that is symmetrical bilaterally, indicating his cranial nerve number 11 is intact. Now I'm going to move on to his feet, and I'm going to have him pick up his feet against me and push his feet against me. His 5 out of 5 strength in his feet. Now your knees, so bend your knees for me and push against me, pull against me, and he has 5 out of 5 strength in his knees. Now I'm going to have him push against me and pull against me with 5 out of 5 strength in his hips. All right, now we're going to move on to range of motion. And for range of motion, we're going to start with his fingers, and we're going to flex, extend, hyperextend, abduction, adduction, thumb opposition, wrist, flex, extend, hyperextend. We are at radial deviation, so now we're going to do ulnar deviation and then rotation. All right, and then with your shoulders, we're going to do this. This is going to tell me internal and external rotation, extension, hyperextension, and flexion. And then we're going to move on to abduction, adduction, and then circumduction. And he has full range of motion noted in his shoulders. Now we're going to do his elbows. So I'm going to have him flex, extend, hyperextend his elbows, full range of motion in his elbows. Now we're going to move on to his toes, and we're going to flex, extend, hyperextend, abduct, adduct, full range of motion in our toes. Now with our ankles, we're going to plantar flex, dorsiflex. We're going to do inversion, eversion, and then rotation. Full range of motion there. All right, now we're going to go on and have this patient stand up. And we're going to check the range of motion in our knees. We're going to flex, extend, hyperextend, and the other one. Flex, extend, hyperextend, full range of motion in your knees. Now we're going to move on to our hips. So we're going to flex, extend, hyperextend. I'm sorry, this is flex, extend, hyperextend. Okay. Now the other one, so I'm going to start with flex, extend, hyperextend. All right, now we're going to abduct and adduct. And then we're going to internally rotate. Oh, sorry. and then the other one. And then externally rotate them both, one at a time. All right, so you do have full range of motion in your hips. Now we're going to move on to our cervical spine. We're going to flex, extend, hyperextend, and then we're going to do rotation, left and right. Then we're going to do lateral flexion. So he has full range of motion in his cervical spine. Now we're going to move on to our lumbar spine. We're going to flex, extend, hyperextend, and then lateral flexion, and then rotation. Okay, so he has full range of motion in his lumbar spine. Now I'm going to go on and have this patient turn around for me and bend over and touch your toes. And I'm just noting if his spine is straight. It is straight without crepitus. Do you have any tenderness?
No.
Okay, and there's no tenderness, no warmth, no discoloration. It is symmetrical. There's no obvious deformities. He does have a normal spine curvature and no scoliosis noted. So that those are normal findings. So I'm going to have him walk over to the wall for me. And then walk normally to the camera. And then stop. And then walk back heel to toe. So this patient does have a gait within normal limits, both tandem and walking. So now I'm going to have this patient stand on one foot and hop. Stand on the other foot and hop. All right. And now I'm going to have this patient put their feet close together and close their eyes with their arms out. This is testing their Romberg, and their Romberg is negative because they are able to maintain balance. Now I'm going to have the patient have a seat while I review my assessment to see if there's anything we need to go back to. All right, that completes our assessment today, so thank you very much.